Welcome to our video series, Conceptual Relationships of Words in the English Language. In this series, we present English vocabulary in a structured and hierarchical manner. Each video showcases a range of terms and their corresponding definitions, presented in an organized sequence from broader concepts to more specific details. The series is divided into playlists, videos, and sections, each delving into distinct aspects of the English language. To get the most out of these videos, here are some of the suggested uses. We will be using WordNet as our primary reference throughout the series. For detailed information about WordNet, please visit the official WordNet website. If you're new to our channel, we recommend starting with our introductory videos. They provide essential context for understanding our approach, purpose, and methodology. For simpler navigation, we presented an outline of the terms and relationships in one of these introductory videos. Remember to show your support by liking, commenting, sharing, and subscribing to our channel. In this episode, we will explore infection and injury. This video is part of the playlist Attribute State. Attribute State playlist is one of two playlists devoted to the conceptual domain attribute. Attributes are linguistic elements that serve as modifiers to provide descriptive information about another word. They convey qualities, characteristics, or properties associated with the entities they modify, enriching the meaning and context of the expression. Section 1. In this section, we will explore infection Part 1.
Condition. Condition.
A state at a particular time.
The current status of the arms negotiations.
Physical condition. Physical condition.
The condition or state of the body or bodily functions.
Pathological state. Pathological state.
A physical condition that is caused by disease.
Ill health. Ill health.
A state in which you are unable to function normally and without pain.
Infection. Infection.
The pathological state resulting from the invasion of the body by pathogenic microorganisms.
Enterobiosis. Enterobiosis.
An infestation with or a resulting infection caused by the pinworm Enterobius vermicularis occurs especially in children.
Focal infection. Focal infection.
Bacterial infection limited to a specific organ or region, especially one causing symptoms elsewhere.
Protozoal infection. Protozoal infection.
Any infection caused by a protozoan.
Amoebiasis. Amoebiasis.
Infection by a disease-causing amoeba.
Amoebic dysentery. Amoebic dysentery.
Inflammation of the intestines caused by Endomoeba histolytica, usually acquired by ingesting food or water contaminated with feces, characterized by severe diarrhea.
Giardiasis. Giardiasis.
Infection of the intestines with protozoa found in contaminated food and water, characterized by diarrhea and nausea and flatulence and abdominal discomfort.
Leishmaniasis. Leishmaniasis.
Sores resulting from a tropical infection by protozoa of the genus Leishmania, which are spread by sandflies.
Cutaneous leishmaniasis. Cutaneous leishmaniasis.
Leishmaniasis of the skin, characterized by ulcerative skin lesions.
Mucocutaneous leishmaniasis. Mucocutaneous leishmaniasis.
A form of leishmaniasis endemic in Mexico and Central America and South America. Sores are limited to the skin and mucosa.
Visceral leishmaniasis. Visceral leishmaniasis.
Leishmaniasis of the viscera.
Malaria. Malaria.
An infective disease caused by spores and parasites that are transmitted through the bite of an infected Anopheles mosquito, marked by paroxysms of chills and fever.
Blackwater fever. Blackwater fever.
Severe and often fatal malaria characterized by kidney damage resulting in dark urine.
Jungle fever. Jungle fever.
Severe form of malaria occurring in tropical regions.
Trichomoniasis. Trichomoniasis.
Infection of the vagina.
Scabies. Scabies.
A contagious skin infection caused by the itch mite, characterized by persistent itching and skin irritation.
He has a bad case of the itch.
Schistosomiasis. Schistosomiasis.
An infestation with or a resulting infection caused by a parasite of the genus Schistosoma, common in the tropics and Far East. Symptoms depend on the part of the body infected.
Staphylococcal infection. Staphylococcal infection.
An infection with Staphylococcus bacteria, usually marked by abscess formation.
Boil. Boil.
A painful sore with a hard core filled with pus.
Gum boil. Gum boil.
A boil or abscess on the gums.
Carbuncle. Carbuncle.
An infection larger than a boil and with several openings for discharge of pus.
Streptococcal sore throat. Streptococcal sore throat.
An infection of the oral pharynx and tonsils by Streptococcus.
Tapeworm infection. Tapeworm infection.
Intestinal infection by a species of parasitic tapeworm, usually the result of eating inadequately cooked meat or fish.
Viral infection. Viral infection.
Infection by a virus that is pathogenic to humans.
Hemorrhagic fever. Hemorrhagic fever.
A group of illnesses caused by a viral infection, usually restricted to a specific geographic area. Fever and gastrointestinal symptoms are followed by capillary hemorrhage.
Argentine hemorrhagic fever. Argentine hemorrhagic fever.
Hemorrhagic fever with neurological signs, caused by the Junin virus.
Crimea Congo hemorrhagic fever. Crimea Congo hemorrhagic fever.
An infection common in Arab states caused by a bunyavirus, transmitted by a tick that thrives on sheep.
Ebola hemorrhagic fever. Ebola hemorrhagic fever.
A severe and often fatal disease in humans and non-human primates, monkeys and chimpanzees, caused by the Ebola virus, characterized by high fever and severe internal bleeding, can be spread from person to person, is largely limited to Africa.
Lassa fever. Lassa fever.
An acute contagious viral disease of Central Western Africa, characterized by fever and inflammation and muscular pains and difficulty swallowing, can be used as a bioweapon.
Marburg disease. Marburg disease.
A viral disease of green monkeys caused by the Marburg virus. When transmitted to humans, it causes serious or fatal illness.
Rift Valley fever. Rift Valley fever.
An infection common in Africa caused by a bunyavirus, transmitted by mosquitoes or by handling infected animals.
Herpangia. Herpangia.
A viral infection, usually in children, marked by sore throat and fever and papules in the mouth and throat and headache and abdominal pain, usually subsides in a short time.
HIV. HIV.
Infection by the human immunodeficiency virus.
Viral pneumonia. Viral pneumonia.
Pneumonia caused by a virus. Section 2. In this section, we will explore infection part 2.
Opportunistic infection. Opportunistic infection.
Any infection caused by a microorganism that does not normally cause disease in humans occurs in persons with abnormally functioning immune systems, as AIDS patients or transplant patients receiving immunosuppressive drugs.
Aspergillosis. Aspergillosis.
An opportunistic infection by a fungus of the genus Aspergillus, characterized by inflammation and lesions of the ear and other organs.
Sepsis. Sepsis.
The presence of pus-forming bacteria or their toxins in the blood or tissues.
Blood poisoning. Blood poisoning.
Invasion of the bloodstream by virulent microorganisms from a focus of infection.
Foul cholera. Foul cholera.
An acute diarrheal disease, especially of chickens, caused by the microorganism that causes hemorrhagic septicemia.
Puerperal fever. Puerperal fever.
A serious form of septicemia contracted by a woman during childbirth or abortion, usually attributable to unsanitary conditions, formerly widespread, but now uncommon.
Pyemia. Pyemia.
Septicemia caused by pus-forming bacteria being released from an abscess.
Shipping fever. Shipping fever.
A deadly form of septicemia in cattle and sheep, involves high fever and pneumonia, contracted under conditions of exposure or exhaustion, as often happens when the animals are shipped to market.
Toxemia. Toxemia.
Blood poisoning caused by bacterial toxic substances in the blood.
Supremia. Supremia.
Blood poisoning caused by putrefactive bacteria, results from eating putrefied matter.
Superinfection. Superinfection.
Infection that occurs while you are being treated for another infection.
Vaccinia. Vaccinia.
A local infection induced in humans by inoculation with the virus causing cowpox in order to confer resistance to smallpox, normally lasts 3 weeks, and leaves a pitted scar.
Progressive vaccinia. Progressive vaccinia.
A severe or even fatal form of vaccinia that occurs mainly in persons with an immunological deficiency, characterized by progressive enlargement of the initial lesion.
Non-social infection. Non-social infection.
An infection that is acquired at a hospital or other healthcare facility.
Superinfection. Superinfection.
Secondary infection caused by an opportunistic infection.
Tetanus. Tetanus.
An acute and serious infection of the central nervous system caused by bacterial infection of open wounds. Spasms of the jaw and laryngeal muscles may occur during the late stages.
Toxoplasmosis. Toxoplasmosis.
Infection caused by parasites transmitted to humans from infected cats. If contracted by a pregnant woman, it can result in serious damage to the fetus. Section 3. In this section, we will explore infection part 3.
Felon. Felon.
A purulent infection at the end of a finger or toe in the area surrounding the nail.
Paronychia. Paronychia.
Infection in the tissues adjacent to a nail on a finger or toe.
Respiratory tract infection. Respiratory tract infection.
Any infection of the respiratory tract.
Lower respiratory infection. Lower respiratory infection.
Infection of the lower respiratory tract.
Upper respiratory infection. Upper respiratory infection.
Infection of the upper respiratory tract.
Sore. Sore.
An open skin infection.
Blain. Blain.
An inflammatory swelling or sore.
Chilblain. Chilblain.
Inflammation of the hands and feet caused by exposure to cold and moisture.
Cub. Cub.
Ulcerated chilblain on the heel.
Chancre. Chancre.
A small hard painless nodule at the site of entry of a pathogen, as syphilis.
Fester. Fester.
A sore that has become inflamed and formed pus.
Gall. Gall.
A skin sore caused by chafing.
Saddle sore. Saddle sore.
Sore on a horseback rider chafed by a saddle.
Sty. Sty.
An infection of the sebaceous gland of the eyelid. Section 4. In this section, we will explore injury part 1.
Injury. Injury.
Any physical damage to the body caused by violence or accident or fracture, etc.
Brain damage. Brain damage.
Injury to the brain that impairs its functions, especially permanently, can be caused by trauma to the head, infection, hemorrhage, inadequate oxygen, genetic abnormality, etc.
Dislocation. Dislocation.
A displacement of a part, especially a bone, from its normal position, as in the shoulder or the vertebral column.
Abarticulation. Abarticulation.
Dislocation of a joint.
Diastasis. Diastasis.
Separation of an epiphysis from the long bone to which it is normally attached without fracture of the bone.
Spondylolisthesis. Spondylolisthesis.
A forward dislocation of one vertebra over the one beneath it, producing pressure on spinal nerves.
Strain. Strain.
Injury to a muscle, often caused by overuse, results in swelling and pain.
Wrench. Wrench.
A sharp strain on muscles or ligaments.
The wrench to his knee occurred as he fell.
Sprain. Sprain.
A painful injury to a joint caused by a sudden wrenching of its ligaments.
Wound. Wound.
An injury to living tissue, especially an injury involving a cut or break in the skin.
Abrasion. Abrasion.
An abraded area where the skin is torn or worn off.
Graze. Graze.
A superficial abrasion.
Rope burn. Rope burn.
Abrasion, usually on the hands, caused by friction from a rope.
Bite. Bite.
A wound resulting from biting by an animal or a person.
Dog bite. Dog bite.
A bite inflicted by a dog.
Snake bite. Snake bite.
A bite inflicted by a venomous snake.
Cut. Cut.
A wound made by cutting.
He put a bandage over the cut.
Laceration. Laceration.
A torn ragged wound.
Raw wound. Raw wound.
A wound that exposes subcutaneous tissue.
Stigmata. Stigmata.
Marks resembling the wounds on the crucified body of Christ. Section 5. In this section, we will explore injury part 2.
Birth trauma. Birth trauma.
Physical injury to an infant during the birth process.
Bleeding. Bleeding.
The flow of blood from a ruptured blood vessel.
Blood extravasation. Blood extravasation.
The leakage of blood from a vessel into tissues surrounding it can occur in injuries or burns or allergic reactions.
Cerebral hemorrhage. Cerebral hemorrhage.
Bleeding from a ruptured blood vessel in the brain.
Hemorrhagic stroke. Hemorrhagic stroke.
Stroke caused by the rupture of a blood vessel in the brain.
Hyphema. Hyphema.
Bleeding into the interior chamber of the eye.
Metrorrhagia. Metrorrhagia.
Bleeding from the uterus that is not due to menstruation, usually indicative of disease, as cervical cancer.
Nosebleed. Nosebleed.
Bleeding from the nose.
Olomorrhagia. Olomorrhagia.
Bleeding of the gums.
Bruise. Bruise.
An injury that doesn't break the skin but results in some discoloration.
Ecchymosis. Ecchymosis.
The purple or black and blue area resulting from a bruise.
Petechia. Petechia.
The minute red or purple spot on the surface of the skin, as the result of tiny hemorrhages of blood vessels in the skin, as in typhoid fever.
Shiner. Shiner.
A swollen bruise caused by a blow to the eye.
Intravasation. Intravasation.
Entry of foreign matter into a blood vessel. Section 6. In this section, we will explore injury part 3.
Blast trauma. Blast trauma.
Injury caused the explosion of a bomb, especially in enclosed spaces.
Blunt trauma. Blunt trauma.
Injury incurred when the human body hits or is hit by a large outside object, as a car.
Bump. Bump.
A lump on the body caused by a blow.
Burn. Burn.
An injury caused by exposure to heat or chemicals or radiation.
Electric burn. Electric burn.
A burn caused by heat produced by an electric current.
First-degree burn. First-degree burn.
Burn causing redness of the skin's surface.
Sunburn. Sunburn.
Redness of the skin caused by exposure to the rays of the sun.
Scald. Scald.
A burn caused by hot liquid or steam.
Scorch. Scorch.
A surface burn.
Second-degree burn. Second-degree burn.
Burn causing blisters on the skin and superficial destruction of the dermis.
Third-degree burn. Third-degree burn.
Burn characterized by destruction of both epidermis and dermis.
Electric shock. Electric shock.
Trauma caused by the passage of electric current through the body, as from contact with high voltage lines or being struck by lightning, usually involves burns and abnormal heart rhythm and unconsciousness.
Frostbite. Frostbite.
Destruction of tissue by freezing and characterized by tingling, blistering and possibly gangrene.
Trench foot. Trench foot.
Resembling frostbite but without freezing, resulting from exposure to cold and wet.
Penetrating trauma. Penetrating trauma.
Injury incurred when an object, as a knife or bullet or shrapnel, penetrates into the body.
Pinch. Pinch.
An injury resulting from getting some body parts squeezed.
Sting. Sting.
A painful wound caused by the thrust of an insect stinger into skin.
Bee sting. Bee sting.
A sting inflicted by a bee.
Flea bite. Flea bite.
A sting inflicted by a flea.
Mosquito bite. Mosquito bite.
A sting inflicted by a mosquito.
Whale. Whale.
A raised mark on the skin, as produced by the blow of a whip, characteristic of many allergic reactions.
Whiplash. Whiplash.
An injury to the neck, the cervical vertebrae, resulting from rapid acceleration or deceleration, as in an automobile accident. Section 7. In this section, we will explore fracture and rupture.
Fracture. Fracture.
Breaking of hard tissues such as bone.
The break seems to have been caused by a fall.
Comminuted fracture. Comminuted fracture.
Fracture in which the bone is splintered or crushed.
Complete fracture. Complete fracture.
Break involving the entire width of the bone.
Compound fracture. Compound fracture.
Bone fracture associated with lacerated soft tissue or an open wound.
Compression fracture. Compression fracture.
Fracture in which the bone collapses, especially in short bones such as vertebrae.
Depressed fracture. Depressed fracture.
Fracture of the skull where the bone is pushed in.
Displaced fracture. Displaced fracture.
Fracture in which the two ends of the broken bone are separated from one another.
Fatigue fracture. Fatigue fracture.
Fracture resulting from excessive activity rather than a specific injury.
Hairline fracture. Hairline fracture.
The fracture without separation of the fragments and the line of the break being very thin.
Impacted fracture. Impacted fracture.
Fracture in which one broken end is wedged into the other broken end.
Incomplete fracture. Incomplete fracture.
Fracture that does not go across the entire width of the bone.
Green stick fracture. Green stick fracture.
A partial fracture of a bone, usually in children, the bone is bent but broken on only one side.
Simple fracture. Simple fracture.
An uncomplicated fracture in which the broken bones do not pierce the skin.
Rupture. Rupture.
State of being torn or burst open.
Hernia. Hernia.
Rupture in smooth muscle tissue through which a bodily structure protrudes.
Colpocele. Colpocele.
Hernia projecting into the vagina.
Cystocele. Cystocele.
Hernia in which the urinary bladder protrudes through the wall of the vagina, sometimes occurs after childbirth.
Rectocele. Rectocele.
Protrusion or herniation of the rectum into the vagina can occur if pelvic muscles are weakened by childbirth.
Diverticulum. Diverticulum.
A herniation through the muscular wall of a tubular organ, especially the colon.
Meckel's diverticulum. Meckel's diverticulum.
A congenital diverticulum in the ileum resulting from incomplete closure of the yolk sac.
Eventration. Eventration.
Protrusion of the intestine through the abdominal wall.
Exumphallos. Exumphallos.
An umbilical hernia at birth in which some abdominal organs push into the umbilical cord.
Hiatus hernia. Hiatus hernia.
Hernia resulting from the protrusion of part of the stomach through the diaphragm.
Inguinal hernia. Inguinal hernia.
Hernia in which a loop of intestine enters the inguinal canal, the most common type of hernia in males.
Keratocele. Keratocele.
Hernia of the cornea.
Laparocele. Laparocele.
Hernia through the abdomen.
Umbilical hernia. Umbilical hernia.
Protrusion of the intestine and omentum through a hernia in the abdominal wall near the navel, usually self-correcting after birth.
Herniated disc. Herniated disc.
A painful rupture of the fibrocartilage of the disc between spinal vertebrae occurs most often in the lumbar region. End of episode. Thank you for watching. If you enjoyed this video, don't forget to like, comment, share, and subscribe to our channel for more engaging content. In the next episode, we will present attribution.